We recommend that you do the exercises twice a day for 20 reps apiece. In this exercise, you are going to bring your toes toward your nose and then point them down. Do both ankles at the same time and remember to perform this exercise slowly. On this exercise, you're going to think about pumping that fluid out of your legs because a lot of times after surgery, you're going to build up some fluid and swelling in your feet and legs. Quad sets. In this exercise, you will be tightening the muscles on the front of your leg. You will do this by pushing your knees down into the surface you're lying on and hold that contraction for 3 to 5 seconds. If you do this exercise correctly, your heels will slightly come up from the surface you're lying on. Gluteal sets. Here you will be squeezing your bottom muscles together and holding the contraction for 3 to 5 seconds. You should be able to feel that contraction if you put your hands on your bottom muscles. Hip abduction and adduction. In this exercise, you will slide your operated leg out to the side and bring it back to the center. You should keep your kneecap pointing up during this exercise. We have a towel roll here made up of 2 blankets held together by 2 rubber bands. You could also use a coffee can and wrap a towel around the can, or a small waste basket. Short arc quads. In this exercise, you will be placing the towel roll under your knee. The starting position is with your heel resting on the surface you're laying on. Then you will slowly straighten your leg and hold that contraction for 3 to 5 seconds. Then you will slowly bring your heel down to the surface. Long arc quads. In this exercise, you will want to sit on a surface where you can let your legs dangle. Here, you will straighten your leg as much as possible and then slowly bring it back towards the surface you're sitting on and pull your leg back as far as possible. Standing heel toe raises. There are 2 parts to this exercise. In part A, you'll be raising up on your toes as if you're making yourself taller. Then slowly bring your heels back to the ground. In part B, you'll be lifting your toes from the ground. Try not to lean back or rock backwards, as you could easily lose your balance. It is a good idea to hold on to a firm surface like a countertop or hold on to your walker. Standing knee flexion. In this exercise, you will be standing on your good leg and bending up your operated leg. You want to make sure that you do not bring your thigh forward and that it is parallel with the leg you're standing on. You will slowly bring it upward and then bring it down to the floor and then put some weight through that leg before beginning the next repetition. Standing rocks. In this exercise, you'll put one foot in front of the other and shift your weight between your feet. When you've done 20 reps, switch your feet so the opposite foot is in front. Standing partial squats. In this exercise, you will be doing a mini squat. Here you are simply going to stick your bottom out and bend down like you're sitting in a chair. Make sure that your knees never go past your toes and that your knees and feet stay in line with your hips.